By the end of this educational video for nurses, you will be able to connect, disconnect and cleanse the night drainage system, measure the stoma accurately using a stoma guide, and master the process of changing the stoma bag.
When you're preparing the environment for the patient to carry out their stoma bag change, you need to make sure you have the necessary equipment ready in advance so that they're not looking for something short notice. So the patient can either be sitting at the bedside with a basin of water to wash their hands, or sitting in the bathroom in front of the sink where they can wash their hands. So what you'll need on your trolley is another little bowl of water so they can wet their gauze. You will need a plastic bag to dispose of the old bag, and you'll need an incontinence sheet to protect their lap from any trickles of urine. You will also need an adhesive remover spray to take the bag off the patient's skin, and you will need a measuring guide to measure the size of the stoma and a curved scissors to cut out the stoma bag. It's also very handy to have a mirror so that the patient can see their stoma more readily. So at least once a week for the first 6 weeks, the patient will need to resize their stoma. So if you know that the patient's stoma was 35 millimeters yesterday, you can prepare the bag in advance so there's less to do when the patient has their bag off. So in the morning time, when your patient wakes up and sits out at the bedside, it's good to get them independent with their stoma care at an earlier stage, especially if they're on the enhanced recovery program, because their length of stay will be a lot shorter. So if they're well enough, encourage your patient to disconnect their night drainage bag. So this is the connector on this particular bag that goes between the bag and the night drainage bag. The reason being is the diameter of this is the same as the diameter of the outlet. Whereas if you shoved a wider connector through to this opening, when you go to attach the cap, it might be too wide to accommodate it. So in the morning, get your patient to disconnect their night drainage bag. Some of the other appliances may have a clip mechanism, but that can be discussed at a ward level when you're dealing with a particular patient. So for the purpose of this video, this is the connector that we're using, and we're plugging the bag, okay? You get your patient then to go out to the toilet and to supervise them emptying the contents of their night bag. You will get the measurement in the bag to know how much was in it overnight. Then they'll close their night bag and bring the bag over to the sink, where they're going to run warm water through the night bag and then give it a little swish and a rinse, get rid of some of the mucus that may have collected at the top, and clean it out again. So this bag is okay to reuse. Usually the patient, when they're at home, changes the bag twice a week. So we tell them to pick 2 days in the week, whether it be a Sunday, a Wednesday, a Monday or a Thursday, to choose those days to change their night drainage bag. But every other morning they're going to rinse the bag through with the warm water. They can use vinegar or maybe a little bit of Milton either. But the most important thing is making sure that the top of the night drainage bag is sealed. So whether it be the cap that originally came with the bag, or a bit of cling film or tin foil, or what we use here in the hospital sometimes is a gloved finger tied in a knot, so that if it accidentally falls on the ground, it's not contaminated, because you don't want to cause cross-infection then when they're reconnecting their night drainage bag. So in the evening time, when the patient connects the night drainage bag to the urostomy bag, it is advisable to tell the patient to leave a little bit of urine in the bag when they're connecting it to prevent an airlock. So I always say just point the outlet up to the roof, pinch and disconnect, and then allow your night drainage bag to accept the urine and prevent an airlock. Okay. So hand washing is very important to prevent cross-infection with the urostomy, because there's no sphincter within the stoma to prevent cross-infection. So after the patient empties their night drainage bag, it's really important that they wash their hands. When they're going to take off their old bag, you want to make sure that the bag is emptied to avoid spillage, that the patient is sitting out in the chair preferably, or standing if they're well enough. So usually on day one, the patient doesn't feel up to doing much education. But on day two, if they're sitting out in the chair, we really would encourage you to firstly get the patient to observe you changing the bag, and then the following day that the patient starts to participate in the bag change, and each day they're building on the skills that they've learned. We do daily bag changes here in the hospital, so that by the time the patient goes home, they're confident with changing their urostomy bag. But when they go home, they can extend the wear time to every second day, and then once they're satisfied with the seal on the bag and their technique, they can leave the bag on for up to 3 days. But any longer than that, the adhesive quality on the bag diminishes, and it could be another source of infection if the bag is on for too long. So having disconnected the night drainage bag, it's ideal that your patient would be sitting out in the chair, and when they're well enough, even standing with the mirror placed on the trolley. So what we're going to use to take the bag off is an adhesive remover spray. Next, we're going to use the adhesive remover spray to ease the bag off the skin. There are also adhesive remover wipes available for this purpose. If a patient runs out of their adhesive remover spray at home, just encourage them not to panic, that once they remove the bag gently and don't just pull it off quickly, that, you know, they'll be fine. So we go with the adhesive remover spray to ease the bag off the skin. And then you dispose of your bag into the waste disposal. So it's important to look at the back of the bag and see, is there any hidden seepage out a particular side? And that patient may need to use an extra seal on that side. So what we use to clean around the stoma is gauze and warm water. So there will be stitches holding the stoma into position, and they're dissolvable. They'll fall out 4 to 6 weeks after the operation. So we use gauze and warm water to clean around the stoma, taking away any excess blood or mucus from the skin, and also any residue of the adhesive remover. We also clean the urostomy stents. So some of these stents may be sutured in position, and some of them may not. So you have to take very good care not to accidentally dislodge the stents as you're removing the stoma bag. So it's best to pick the stents out of the stoma bag. So you will see from time to time mucus congealing around the top of the stents. So it's important to clean from the top, pinch the top of the stents and clean down the length of the stents. Okay. Then you're going to get your patient to pat the skin dry. So while the stents are in, they normally encourage the flow of urine further away from the patient, but there can be an odd trickle from around the stoma. So you have to really make sure that it's good and dry underneath. You may see spotting of blood on cleaning, but that's okay, not to panic. So obviously for the first bag change, you're going to have to use the measuring guide, okay? So it's important not to cut the bag too tight because the bowel is wet and the mucus from the stoma can seep under the seal if the seal is too tight. If it's too big, the urine is going to macerate the skin and cause redness, which will leave the bag harder to stick. So our general rule of thumb is to leave 2 millimeters of skin visible all the way around. So that is probably slightly too much with the 30. So I'm going to try 28. Okay, so to me that's a better fit with the 28 on this particular stoma. So usually 2 millimeters all the way around. So then we go to our bag, and you will see the dials on the back of the bag to give you a guide. So there's 25, the dotted line is 30, so I'm going in between the two, and we're going anti-clockwise. So the patient, if they're willing and able to do this, get them to participate with this aspect of care. Okay, then we're going to remove the film at the back, and then we are going to get our additional seal. So this is really good for helping to prevent seepage of urine from around the stoma. So there's different ways of putting it on. Personally, I wouldn't put it on the skin first with the urostomy because it could trickle and wet your seal and waste it. So what we normally recommend people to do is put it on the bag first. You can either stretch it to size, or another technique that we use is centering the seal on top of the bag and rolling it back and making a little lip. And that lip acts as a double barrier around the urostomy. Okay, so then we're going to place our bag. So the patient may be able to pull their tummy up to see the spout of the stoma better as they guide the bag on. Another technique is to fold the bag in half and place it in under the stoma when the stents are gone. So we're going to feed our stents into the bag. So all in all, the patient is going to make sure that there's a good seal around the stoma first, because that's the most important part of the seal. Then they're going to go to the bottom of the bag, up along the sides and up to the top. So if there's a crease, they can see it and they can pull it back and iron out that crease. Okay, and then making sure that the bottom of the bag is plugged closed, and keeping their hand over the stoma for about 2 to 3 minutes, as the heat of their hand will help mold the bag to their skin, and not to do any bending motion for about 10 minutes afterwards. Hand washing is very important. So throughout the course of the bag change, the patient is going to wash their hands before they empty the night drainage bag and after emptying the night drainage bag. When they're finished cleaning around their stoma, they're going to wash their hands, and at the very end wash their hands. So you're talking about washing your hands about 4 times throughout the bag change process. So if your patient's wound is quite close to the urostomy bag and you're not gaining an effective seal, another trick that you can use is cutting the bag off center. So this time I'm taking my 28 and I'm going over to the left hand side of the bag and drawing my 28. So I'm ignoring the lines on the bag and cutting out my 28 to the side. So then there's going to be less adhesive sitting on my wound.